Welcome to Schupak Sports. I'm Marty Schupak. Today we have a real special guest, Dr. Jesse Mez from Boston University, who works in the CTE department. I'm going to yield to Dr. Mez if you could do the exact pronunciation, because I always have a hard time. It's called Chronic Traumatic
Encephalopathy.
Encephalopathy. Yeah, and this has been in the news like I'd say the last 10, 15 years, but could you give a brief history of CTE going back? And I had read in some of the literature about it was originally like punch drunk, which addressed it with boxing.
Right. So it's been described since the 1920s, and it was initially described in boxers using the term punch drunk. And at that point, the discussion was more about motor symptoms and changes in speech, but there was also a cognitive piece to it as well. And it was described by Martlin and JAMA back then. And for instance, when I was in medical school, we learned about dementia pugilistica, which was another term that was used, but it was a rare disease that was only seen occasionally in boxers, and folks would go their entire careers without seeing it. It's more recently that we've seen that it's probably more common than that and related to a host of different contact sports.
Right. And could you give a brief history of the Boston University CTE Center?
Sure. So the center started around 2009, 2010. I arrived in 2013, so it predates me. It began because Anne McKee, who is a neuropathologist, had reviewed a couple of cases, at first of a boxer, and who had carried a diagnosis of Alzheimer's in life, and she looked at the brain, and it did not look like Alzheimer's at all. And she, went back to the literature and started to learn more about dementia pugilistica, which has now been kind of recoined as chronic traumatic encephalopathy. Around that time, there were also two cases described in NFL players. And then another NFL player came to Anne, Dr. McKee, and she observed again this pattern of pathology. And with that, she became very interested in it. And then around the same time, Chris Nowinski, who is a former Harvard football player turned pro wrestler, was having symptoms from hitting his head repeatedly. And he reached out to Bob Cantu, who is a neurosurgeon, very interested, world expert in head injury. And the three of them, as well as Bob Stern, who is a neuropsychologist, all became very interested in this, and more folks started to donate their brain. More attention was placed on it, and it sort of snowballed such that this brain bank grew really, really quickly. And now, for instance, we have 1,600 brain donors of folks who have had repetitive head impacts from contact sports, military service, intimate partner violence.
Right. I just want to go through the process, and for any listeners that's a little squeamish, you have to please forgive me. I saw that the center, I guess the brain bank, has, I believe, 72 hours. Can you go, is that right? 72 hours to retrieve the brain? Am I mistaken?
Yeah, so that's usually the case, right? So the tissue quality deteriorates after when the postmortem interval exceeds that much time.
So I'm going to give I don't know if it's a fair scenario, but let's say you're in the East Coast, Northeast. Just go through the procedure. If someone, let's say in the state of Washington, who's a donor and passes away, and the BU CTE Center has to get that brain to the center. What happens from the moment that he passes away?
Right. Well, so it doesn't have to get to the center in that much time. It needs to be frozen or put in fixative. So it's not like it needs to get to the East Coast in
Okay.
that much
All right.
time.
Okay.
So we have this. So I think first, I'm a neurologist, a behavioral neurologist. I'm not on the pathology side, though I'm pretty familiar with the pathology side. We have a team of research assistants who are incredibly familiar with the process of donation. And we have a long list of Deaners, of folks who retrieve the brains.
Okay.
And so we have this really nice network at this point around the country to help retrieve the brain when somebody has passed away. And then we have a 24-hour pager where our research assistants speak with family members to get their consent. And then we also have a process where folks agree to brain donation in life, so that they're already familiar with the process, and so that expedites things too.
Okay. And we talked to Dr. Jesse Mez from the Boston University CTE department. I'm going to get into your background in a second. And everything I've read, and I've actually reviewed a few of your presentations on YouTube, but we cannot determine CTE until the patient is dead. But I'm just wondering, are we anywhere closer to trying to determine, and not just by people's actions, but it could be like a scan of the brain or something medical that I don't know, where we could determine on the brain while they're alive. Are we anywhere closer to that time? It seems like that's the holy grail of this whole business.
Sure. So I think it's important to understand the bigger context. So neurodegenerative diseases like Alzheimer's, like CTE, are only definitively diagnosed postmortem after death. But we make diagnoses like Alzheimer's disease in life very regularly. And we've done that for many years. And for a long time, we did it based on syndrome, clinical syndrome. Somebody has this progressive memory problem over time, and we don't have any other clear explanation. And then we've done that for several other neurodegenerative diseases too. We are in the process of getting to that point in CTE. We proposed these criteria back in 2014 to diagnose CTE in life, and we tested them in the research space compared to the gold standard neuropathology, and they did not perform that well. So we revised those criteria, and we just finished reevaluating them. The next set of criteria that were published in 2021. And we haven't published that paper yet, and we're still analyzing the data. So it's I think premature to talk about those results.
Sure.
But preliminarily, they do look a little bit better, or significantly better. And we had a preliminary session where we presented some of those results. That being said, chronic traumatic encephalopathy can look very much like Alzheimer's and like other neurodegenerative diseases, and we're never quite sure how to distinguish them. In Alzheimer's disease, we have developed these really good biomarkers, either PET scans, lumbar punctures, blood-based biomarkers, and that has improved our ability to diagnose it in life. We have several studies underway to develop those type of biomarkers in life too. So we haven't found the ideal biomarker yet, but those studies definitely continue. I will say, unlike Alzheimer's disease, and unlike a lot of these other diseases, we know the risk factor so much better for CTE. Somebody who's had extensive repetitive head impacts from contact sports. They were an elite athlete. They played in college. They played professionally. And then they present years later with memory problems that looks like Alzheimer's disease. We do the test for Alzheimer's disease, and it's not Alzheimer's disease. There isn't a lot else it can be, right? So I think those types of approaches will allow us to start making these diagnoses in life in the near future.
Yeah, and it's funny, doctor, because, well, not funny, but reading a lot of the research I was trying to do and a lot of the stories, and there are tragic stories, but one of the most tragic I read was the story about this John Grimsley, who played in the NFL for 9 years, and he used to clean his gun when his family was out of the house, but apparently he had forgotten that the gun had bullets in the chambers, and unfortunately he ended up killing himself, which is horrific in my mind too. And it's just, I guess it's one of those things. But I want to get into your background, Dr. Mez. So give us a little bit of your background, let's say where you were brought up and like after high school.
Sure. So I'm from Baltimore originally. I grew up after the Colts had left, but before the Ravens had really arrived. That being said, I then went to medical school at University of Maryland in Baltimore. My father was a football fan, and we did go to Ravens games. So I do have some background, some interest, but I've never been a giant football fan.
Right.
Right. So yeah. So I did residency in neurology in Boston at Mass General and the Brigham. And then I did an aging and dementia fellowship at Columbia in New York. And, my course was very much about neurodegenerative disease and treating Alzheimer's disease. And I heard Dr. McKee give grand rounds when I was a fellow at Columbia. And they were looking for a behavioral neurologist at BU to work in their Alzheimer's disease center. And I thought this question was really interesting and important and hadn't been explored. And then there was other really good Alzheimer's research going on at BU too. So it was a really good opportunity, and kind of the rest is history. We've learned a lot about the clinical syndrome, a lot about risk factors, and the fact that it is a neurodegenerative disease, not unlike Alzheimer's disease, has let these folks who are experts in the neurodegenerative space really move the CTE field forward.
Okay, great. That's terrific. In some of the literature, doctor, I was reading, it seems to be the recent trend is like young elite athletes are being diagnosed with CTE. Have you guys found that the last couple of years too?
So the brain bank contains individuals who range in age from their late teens to over 100. And, we've observed CTE pathology in individuals as young as 18 or 19, and then going all the way up. It appears to be a progressive disease. So when we see that tau pathology in those young folks, it's an isolated lesion. It's probably not enough to cause symptoms in and of itself. But what we know about Alzheimer's disease is that the pathology begins 15 to 20 years before folks start to have symptoms. So I think the difference with Alzheimer's disease is that in CTE, we still see a lot of symptoms even when there's this low-level pathology. And it's really complicated to understand, is it really due to this tau pathology, this neurodegeneration, which is happening, but to a very small extent in these younger people? Or is it a host of other things that are happening? And it's really complex as to what could be happening. Who is it that's deciding to play football? It might be somebody who's more aggressive and has a predisposition to being aggressive. Then we know that head injury, concussion outside of a neurodegenerative process is also linked with increased risks of depression, increased suicidality. So there might be things that aren't neurodegenerative, but changes in the brain that are happening. And then there might also be this neurodegenerative process. So it's kind of disentangling all of these things in the younger folks.
Right. And when I was fascinated that they have sensors now in helmets, is that in all helmets in the NFL, or is it specific teams or positions?
Right. So the NFL had a period where they had sensors in the helmets. I can't speak to whether they have them now. I'm pretty sure they do not have them anymore, and they've now moved to mouth guard sensors. The helmet sensor data has been placed in youth players, high school players, college players, and there have been a bunch of publications using that sensor data. We published a paper where we used the sensor data from living players, and we projected it onto our brain donors to get a better sense of how the repeated hits are related to the pathology. And what we learned was it was the accumulation of the number of hits as well as how hard those hits were over the course of a athletic career, of a football career, that was associated with CTE pathology and CTE severity. But the NFL hasn't shared that data widely, and I'm not sure where they exactly are with using the helmet sensor data.
Right. And I saw with young athletes, I don't know if I caught this stat right, doctor. I don't want to put you on the spot. It said like 40% of young athletes that died before 30 had CTE. Does that sound right? To me, that's incredible.
So I think it's important to remember so those numbers come from our brain bank, right? Our brain bank is not a representative sample of all football players, right? So the folks who donate to our brain bank tend to have symptoms and tend to be elite players, to have played, a high level college professional. So both of those things drive higher levels of pathology than what we might expect in the general population. That being said, the fact that we are observing it among these individuals at this frequency is still pretty concerning.
Right. And another one of your studies, and again, I hope I read this right, that if an NFL player plays more than 4 years, he increases his chances for severe CTE 10 times. I find that incredible too, but we spoke before you went on the air, we were talking about something else, and you said it's how long a player plays in a particular sport. But is that right with the NFL? I don't know if you're familiar with that study, that if you're increasing it after 4 years.
Well, so what we've shown among all of our brain donors across the spectrum, or all of our football brain donors across the spectrum of play, is that with each additional year of play, the odds increase by about 30%, right? So that spans from youth to professional. The numbers of our NFL players with CTE are incredibly high in the brain bank. Again, we have this folks who donate their brain tend to be symptomatic and to have played years and years. So the cut points that we did propose some cut points. They weren't specific for NFL players. It was more years of so in our traumatic encephalopathy syndrome criteria, the ones that I mentioned about that we're trying to validate right now. We learned from that earlier study that if you play fewer than 5 years of football, the likelihood of getting CTE is unlikely, 10 times less than those who played more than 5 years. And similarly, those who played more than 14 years are 10 times as likely as those who played fewer than 14 years.
Right.
So we've incorporated some of these cut points into diagnostic criteria that we're evaluating now.
Okay, that's great. Now, does the BU Center, or not necessarily your department or other departments, do they work at all with the NFL or youth sports? I know Ann McGee, who to me, she's like a hero. She wrote a protocol paper, I think. I'm trying to locate it, but does your department work at all with the NFL suggestions? Like now, they put some of the players put these outer covers on their helmet, I guess, to lessen the blow. But do you do anything with that with the NFL with equipment or suggestions?
Right. So there is, I think we're cautious to work with the NFL. I think an important part of the research in the living participants, the former players, is the sense of trust. And we don't want to appear compromised as by getting support from the industry that might not want these statements to come out. So I think we're cautious about that. We also provide I provide clinical care for these folks. So we're cautious. That being said, there has certainly been interaction with the NFL.
Right. Now, a number of years ago, we're talking to Dr. Jesse Mez from Boston University. I had heard he's a very renowned football player, and I don't want to mention his name, but he said he had headaches, but then he said that over a period, he took these, I guess he called them hyperbolic dives, and that seemed to have helped cure the headaches. Now, I don't know if this is snake oil stuff or what. Have you heard about this at all?
Right. So hyperbaric oxygen, there isn't data to suggest that it's beneficial for neurodegenerative outcomes. That being said, the lack of data doesn't mean that it doesn't work.
Okay, I understand that. And one of the things I think with this whole CTE is, to me, it's fascinating how sometimes a whole new industry is developed. And a number of years ago, the head football coach, who has since passed away, of Dartmouth, created like an electronic tackling dummy, which they use in practice. I don't know if you've seen that. And now the NFL uses it, which I think is a great thing. So I think that's really fascinating too. And Doctor, we're going to close this out in a few minutes, but I deal with mostly youth coaches and a lot of youth athletes. And I know when I was younger, before I even got into coaching as a parent, when I would see a collision, I would see like a coach or a parent come on, and the young kid would stand up and they'd look in his eyes. I mean, what are they looking for with the pupils? I know you're not a medical doctor, but I have no idea what they're looking at.
Right. So, I think they're looking for focal neurological deficits. So, do the eye movements look normal? Are they able to move all of the parts of their body the same? I think importantly, I work in the neurodegenerative space, so it's really years after the head impacts. And then I think importantly, what we've learned is that it's these repeated hits, these repeated impacts over the course of an athletic career. And it's sort of, we haven't shown that those symptomatic hits, those concussions, are what's driving CTE pathology, but it's the thousands of hits over the career that seem to be leading to CTE.
Right, just so the fans know that are watching this, just to give an analogy. So if a player like the quarterback of the Miami Dolphins, Tua, experienced two concussions in the same year, that may not be as bad as a offensive lineman that's had a number of collisions over a period of 10 years. Is that right? We're talking about concussions versus impact collisions.
So we haven't shown that the symptomatic hits are related to these long-term neurodegenerative outcomes. But it's kind of like I said, the thousands of hits and how hard those hits are. So the linemen who have many, many more hits may be at greater risk. That being said, those hits aren't as hard as some of the speeded players. So in our studies, we've never shown that one position is at greater risk than another position. We've shown that those who have more hits, those who have experienced harder hits, the accumulation of both of those is what leads to the greatest risk.
Right. And if someone that loves sports and, I followed my whole life, and I have a lot of friends that think that they're dumbing down football, where they're taking out a lot of the violence. I know they're trying to change some of the rules. I know Ann wrote that protocol paper. I think was a great idea. So during the week, a lot of teams now don't have contact, which I think is a good idea too. So we're going to wrap it up, Dr. Mez. Now, is there any suggestion for people that parents of young athletes that are very concerned about CTE? Should they be in touch with Boston University or in touch with their own doctor, their own league? Do you have any suggestions for these parents of young athletes?
Sure. So the Concussion Legacy Foundation has excellent information on their website to learn more about CTE. Our BU CTE Center website has a lot on the research that we are doing. I think, my goal is really to educate these parents and these players to understand the risk and then for them to make informed decisions about it. But, I really want to drive home the point that it's each additional hit, these years and years of hits that are the risk. So by reducing in practice, by reducing the years of play, that's really what will reduce risk for this disease.
Okay, great. Dr. Mez, don't hang up. I want to thank you so much. This was very informative, and I want all parents and all people to be aware of this. I always would talk to a friend of mine and say, if you look at the human body from the feet up to the head, it really wasn't made for like tackle football when you think of the knees and the joints and everything. But it's a risk they take. It's interesting too, just to tell you a quick story. I think a lot of this stuff too is so commonsensical. I have a friend, Bill, who's a retired policeman from New York City. He's a part of a group, a motorcycle club. They have lawyers, accountants, doctors, and they get together every June and they go on a trip around somewhere in the country. And he told me once when they were in the Northeast, when they went from, I guess it's Massachusetts to Connecticut, they pulled over and 60 of them, like 40 of them take off their helmets and they drive without helmets because of the law, which I can't understand, and neither could he. To me, it's incredible that every state doesn't have a helmet law. But I want to thank you, and don't hang up or get off, and I will be in touch with you. Thank you so much, Dr. Mez.
All right. Thank you. Thanks.